My name's Tim Ryan. I'm the recruitment caseworker here at Care South. It's becoming more and more stringent and in the guidelines that we need to adhere to. It's the studies that are showing that if you can help out, when the children are young, then you're not going to have these ingrained set-in behaviours when they're a teenager. There's 16,500 kids in care, who need caring, and that's looking to go up. Some of the children who are taken from their families, they might be placed with an auntie or an uncle, or they might go into some other type of accommodation that it mightn't be suitable for them at that time. So that's what we need to do, is we need to make sure that we're creating this environment for these children to be safe and looked after. We take it quite seriously. We don't rush that process, even though we do keep getting the referrals in. But yeah, we're there to sort of make sure that these kids are safe. A lot of people have been thinking about it for a long time. The carers that we assess, they've been thinking about it for a long time, and then they've seen an ad, or they've just gone, right, the kids have left home and that sort of thing. The trend, the common thing for foster care is that people are scared of the behaviours and maybe wouldn't know how to deal with it themselves, and that's where we can come in and we provide that support and that training, and can assist through those times when a child might display some behaviours. But yeah, look, we always will need carers, and eventually, who knows, I might be put out of my job because the kids stay at home. They might create this safe environment, but we need those carers just for this time, just for whether it be for that, as I said, that 2 days or 18 years. The media work with us really well in the way that we're able to, like a couple of times we've run stories about carers who have come, who might inspire other carers to sort of they might say, oh, we're thinking about it for years, and this is our situation, and we became carers. And people who are sitting in the same sort of boat can say, oh, well, if they can do it, we can do it. The problem is with the media and with presenting these stories is that we need to make sure that the confidentiality of the child and the carers is that's the utmost, and we need to look after them. That is a lot. These common misconceptions come in with those 45% as well. That they might be thinking of this, but then there might be this idea that maybe I just can't do it because of this or because of that. And it's really good that we have people who think about that, who mull it over in their heads, who work out opportunities and what are going to be the strengths and weaknesses of it. Sometimes all they need is just for a couple of answers to be thrown their way, and then they're right to go. Other times they need to make sure that their whole family's on board, because you can't have one person wanting to do it within a family of 5 and the other 4 not wanting to do it. Foster caring isn't for everybody. It's not something that we are going out there and just grabbing anyone off the street. It's something that people need to take time with and think about. And it can be a long assessment for some people, and that's just to get to know who they are. In saying that, it can be a great, rewarding and fantastic, thing to take on, to have a child who does something for the first time within your home, experiences something for the first time, laughs for the first time within your placement. It can be a really rewarding thing, and those little things, you mightn't see them, for a while, but when you see them, it's really good to celebrate and enjoy that. So.